Hello, my name is Dr. Luis Toledo, and I am a Brazilian plastic surgeon with over 40 years of experience in plastic surgery. And I have moved to Dubai more than 18 years ago. And this is where I practice and where I have all my patients. When I started plastic surgery, the techniques were completely different. And I learned through the times on how to evolve with the new techniques that came into the market. And this is what a good plastic surgeon does. For instance, in 1980, I was introduced for liposuction, which was a new technique then for the first time. And I started using liposuction in 1982. Another technique that I started doing early on in my profession was fat grafting, using fat from the liposuction area where you aspirate and then inject this fat into another part of the body. This I started doing in 1985, and from then on, we created the term, together with Fournier in France, of liposculpture. That means you can do a sculpture with fat and transform the human body. Not only the body, but also the face. So we have been using this technique. This has been one of the most important techniques in my practice, and it's about 40% of what I do. The other techniques vary from, in second place, rhinoplasty, in third place, breast augmentation or reduction, and in number 4 is face. Facelift, eyelids, blepharoplasty, and in number 4 is abdominoplasty. So early in my career, I started working in congresses, organizing congresses for other plastic surgeons. I was very happy to learn from some colleagues how to do this, how to organize congress, how to invite doctors to come and speak to the new doctors and create perfect lectures so that everybody could understand and that we could spread the word of plastic surgery, not only for doctors, but also for patients. In the end of the 1980s, beginning of 1990s, I started an international career, and I left Brazil and I went to the United States and Europe, and for 15 years, I presented lectures and teaching courses in all the most important congresses of Europe and the United States. And with this, I could enhance my knowledge, because when you go and teach something at the Congress, the most important thing is what you learn when you're teaching. You keep your mind open to new ideas, and then invite your friends that you met abroad to come to where you're working, like I did in Dubai many times. I was one of the directors of the Emirates Plastic Surgery Society for 6 years. And I was the scientific director. And I was organizing courses, monthly courses for the local surgeons, and congresses, annual congresses. And I brought all my friends from all over the world to come and lecture here and improve the level of the plastic surgery in Dubai. Also in plastic surgery, especially in plastic surgery, what you do is to stand on the shoulders of giants. You had your thing and you did what you do, but before you, many other people helped you do what you're doing today. This is a type of science that makes plastic surgery so great in Brazil, and now in Dubai also we're getting very high acclaim for our plastic surgeons here. So early in my career, I had a big preoccupation with facial rejuvenation. When I was younger, I didn't like to see the scars of a facelift on a younger patient. So I started developing smaller procedures to improve the looks of the patient without the big scars. And this works very well for young patients when there is no excess skin. So if you have excess fat, you can remove fat from one area of the face, from the neck, and put it on the cheeks, on the nasolabial folds or marionette lines. And then you can rejuvenate this patient with smaller procedures, sometimes procedures that you can do in an office in about 1 hour under local anesthesia. There's a point, however, where these procedures do not work anymore. There is excess skin and muscle laxity in the neck or in the face, and we have to perform something called facelift, or the normal term is ritidoplasty, and it can be done together with the eyelid surgery, which is called blepharoplasty, and we do this complete facelift. This is for patients 45 years and older than that. Obviously, we can't combine this big procedure with the smaller things, because there are areas that the facelift doesn't treat. For instance, the area around the mouth can only be treated with fat grafting, because there are small wrinkles that do not disappear with the facelift. They can be treated with fat grafting or with Botox or small things, even a peel. Some kinds of peel, depending on the type of skin of the patient, we can have some light peels to make the skin more rejuvenated. Again, there are surgeries for children. Obviously, I do not perform congenital surgery, I only do aesthetic surgery. So the earliest patients that I get are in preschool age patients that have big ears, and you have to clip the ears closer to the head. This is called otoplasty, which is a surgery that we can do for children before they enter school and their colleagues start calling them names and they get this stigma of the big ears. So this is a procedure that's very beneficial for children. Then, if you get to adolescents, there's surgeries that we can do after 14 years old, depending on the approval of the parents and depending on the need of the patient. Sometimes a little bit of liposuction can be done, sometimes a little breast reduction. Some 12-year-old patients sometimes have very heavy breasts and start having problems in the back. So what we have to do is, under general anesthesia, remove the excess of breasts and make a normal breast for that child. This can be done not only in the child, but for any adult person as well. And both surgeries can be done for adults as well, ears and the breasts. And liposuction. Liposuction can be combined with the removal of skin or only aspiration of fat. Some patients are born with very small breasts, and this is always a problem for these patients because they don't feel confident with their clothes, and when they go out, when they buy a bikini, top part doesn't fit, it doesn't match with the lower part of the bikini, and obviously they need bigger breasts. For over 40 years, we have been using silicone implants to augment the breasts, and it's a very safe procedure that takes about 40 minutes to do under general anesthesia, and the patient stays one day in the hospital and goes home totally modified with nice new breasts, and they can perfectly breastfeed a child after that without any problem. And it looks much better, and the patient gets much more confident. Recently, we have been substituting some of the old breast implants with your own fat. If the patient has enough fat, we can aspirate fat from other areas of the body, remove the breast implant when it's very old, like 20 years, 30 years, and then inject fat in the breasts to make the breast bigger. Or if the patient doesn't want a breast implant and has enough fat, we can do the augmentation with the fat. However, fat is not exactly the same as the breast implant. Some of this fat will be reabsorbed, and you're going to lose about 20 to 30% of the volume that was injected. So it might be necessary to do a second procedure after some time. Well, about the thighs, usually the problem of excess volume of fat in the thighs, inner thighs and outer thighs, can be solved with liposuction alone. We aspirate fat and remodel the thigh completely. If there is cellulite, I developed an instrument in 1989 called a V-tip Toledo cannula, which is like a V that goes under the skin and cuts all the adhesions that pull the skin down on cellulite, and then we put some fat under the skin to make the skin very smooth. This is a technique that I developed over 30 years ago and serves me very well, and the patients like the results with this. They also called subcision now, but this is the original thing, was from 1989. Now, once we did all these tricks that we could do, surgeries that we could do, with liposuction alone and with fat injection, it comes to a point when the patient has excess skin. So they either need a body lift to get rid of the excess skin from the sides of the body, or an inner thigh lift to get rid of the excess skin inside the thighs. This can be done in two ways. One is with an incision in the groin. In some cases, it's possible to do just that, lift that skin, and that solves the problem. The other patients that have too much skin excess, we have to do a vertical scar from the groin to the knee and then get rid of all that excess fat and skin. Something that could never be done in the past is to augment calves and ankles. With fat, we can make ankles thicker. Some patients have a nice body, but they have very thin ankles. So we can aspirate some fat and inject into the ankles, inject into the calves, giving the legs a very nice shape. Well, people often ask me different cases that marked my career. And one of them was when a princess in another country realized that she had to be covered from head to almost toe. She could wear sandals, but she didn't like her toes because her toes are very skinny. And she asked me to inject fat in her toes so that she could wear sandals. This is one of these very different cases that I had to do. So I am Dr. Luis Toledo, and I am now working at the Esteva Clinic, and I operate the big cases at the Dubai London Hospital in Jumeirah Beach Road. Please book a consultation, and remember, most of all, experience counts.